And today, as you all know, is tax day, so thanks for taking time out of whatever that requires for you to be with us. You know that Massachusetts is on the forefront of healthcare reform, and we have, with the lowest uninsurance rate in the country, we can take credit for being in the forefront of reform. And today, we're here to talk about allowing us to move forward and be, again, at the forefront on quality and cost as well. I want to recognize the members of the legislature who are here with us this morning. Delighted to have Representative D'Amico, Representative Provo, and Senator Moore join us. Thank you very much for your leadership, and you'll hear from two of them in a bit. Chapter 305 is often referred to as the cost containment law, but in fact, or in the health quality law, the fact is it also includes the words transparency and the quality, and addresses the quality of our healthcare system. Today, we're going to talk about two tangible results of that law with the reports that were issued by the Department of Public Health. The reports focus on healthcare-associated infections and serious reportable events, and they provide information on the number of occurrences for each of these incidents in hospitals in Massachusetts, and then they outline the steps that some hospitals have undertaken to prevent them. We think that these reports provide vital information to consumers and allow consumers to make informed choices to allow them to receive care in the best possible facilities and to focus on the quality and potential outcomes that they'll have with care. We'll hear more details about the reports, but we know that two hospitals who reported higher than average incidents for infections have already been able to address the problems, have been able to look at the root causes and address the problems, which again makes a tremendous difference to consumers and patients within those hospitals. We're very excited to be joined by the Department of Public Health Bureau of Healthcare Safety and Quality and to talk a little bit about their work. The Bureau is responsible for issuing the reports and frankly for protecting Massachusetts residents by investigating quality concerns for health that come generated because of healthcare provider actions in hospitals, nursing homes, and home health care. The Bureau does this work often unrecognized, and we're delighted to be able to highlight their diligence, hard work, and to remind people that often our safety depends on their effectiveness. With the release of yesterday's budget, we know that funding to the Bureau is at risk of being cut substantially, and we hope that you'll all be able to join with Healthcare for All as we advocate for full funding for their life-saving work. It's now my pleasure to introduce two very committed legislators who've worked tirelessly to ensure that Massachusetts residents have access to high-quality health care. Please join me in welcoming Senator Richard Moore and Representative Denise Provo.